Welcome to the HealthCast, where we explore the intersection of healthcare, technology, and business innovation. I'm Phil Zappone, family nurse practitioner and founder of NXAI Growth Consultancy. We help healthcare companies grow with AI and automation. On this show, I speak with founders, clinicians, and innovators who are building the future of healthcare. Today, we're diving into the world of telehealth with Omar Ziyadeh and Ted Bernstein of Revive Telehealth, a digital platform for behavioral health services. We'll explore their journey, their impact, their vision for the future of healthcare delivery. Let's get started. Welcome, gentlemen.
Hey, Phil, how you doing?
I'm doing great, thanks. All right, we'll just get right to it. Omar, can you share your journey into healthcare and what drew you specifically to behavioral health?
Yeah, it's a long-winded story, but I'll be quick about it. I had taken my first job at Westchester Medical Center here in New York as a business manager. And from that point on, my supervisor at the time saw more in me, and he gave me more and more operations opportunities, like running the AIDS care center, running more of behavioral ops. I grew from that point on. What really drew me to telehealth was in about 2015, New York State promulgated some regulations to say now non-state hospitals are allowed to use telehealth. We applied. We're the first non-state hospital to receive approval to use the service. What we saw from there was just an increase of efficiency from porting providers from one location to many of our other locations, cost efficiencies on top of that, and then you had no-show rates that were decreasing significantly. From that, I took that and expanded my knowledge of finance and operations and telehealth, implementation of new projects and programs. I brought that skill set to a company called Aligned Telehealth in California, where I helped them double revenue, decrease cost, and made it very attractive for them to get sold and bought out. Had a lot of fun doing that. We expanded tremendously. From that point on, I took what I learned there, what I learned from Westchester, and made my own company, Revive Telehealth. Honed in on where we could improve some things, expanded the role more into an on-demand, emergency-specific and inpatient unit-specific care, and made it so that I had my own application. We built a tech app to be able to assist with seeing patients, and here we are today.
Ted, you have a background in law, finance, and public health. How did those experiences shape your approach to healthcare business growth?
Well, originally I started out in life sciences. That was my undergraduate background. But then I got very interested in the service side of healthcare and finance and law. And what really drove me in that direction is that while I was doing my training and doing some internships and that sort of thing, everybody was getting very excited about the biotech revolution, the life sciences revolution. And those have been tremendous movers and catalysts and great developments in healthcare and medical care, obviously. And they continue to be. I've been very involved in those spaces as well. But it occurred to me that we can't, on a consistent basis, in an emergency department across the country, service patients that walk in there effectively, safely, with lower wait times, and make the right decision about discharge or admission. I don't mean to cast aspersions on all emergency departments, but my point is that we're in a very tough system of healthcare service delivery. And overall, I think most people would agree that we as a nation and as a society don't do a very good job of that. I did a lot of work in healthcare management, and then I've worked in law and finance to support healthcare companies, mostly healthcare services companies, in developing their businesses, financing their businesses, investing in their businesses, all in an effort to improve the system, make it more efficient, make it safer, make it more accessible to people who need it. That's really what drew me into healthcare. As part of that, I met Omar and Revive Telehealth and was very impressed, and I've worked with Omar in supporting Revive.
This is about our third conversation. It seems like you guys are both business partners and friends and have an excellent rapport and bring some energy to the conversation. Was it Omar's work with the other telehealth company he mentioned in California where the two of you overlapped? Is that right?
I think I was introduced to Ted from a mutual friend. This is going back years. We were both out in California at the time, and he said, yeah, I'm right here, like in your neck of the woods. I said, all right, well, let's just go meet for coffee. So Ted and I just hit it off that afternoon, and it just so happened that I was raising capital, and that's Ted's expertise. So I said, it'd be great to use you as a banker and assist us in the growth capital of what we're trying to do. So that's how, I believe that's how we met. All right?
That's accurate.
Okay, great. And
There
we
it
went for a
is.
cigar and a beer after.
Fantastic. That's a good story. That's what I thought you had mentioned before, so I wanted to include it. Okay. You had mentioned, and I'm gonna butcher it. You had mentioned the passage of a law in the state of New York, and you kind of touched upon it, but I'm gonna segue off of that. What early experiences or aha moments inspired you to start Revive Telehealth?
Just seeing it from the genesis of it developed from Westchester Medical Center, how it could be used at Align Telehealth, where the gaps are and continue to be the gaps in care is what drove me. So the vulnerable population today, the folks that visit emergency departments as their primary care, is what drove me. Like, those folks end up sitting in emergency departments for days trying to get services. And there's a drought of services. Psychiatry is shrinking. More and more people are using the emergency department. Less and less people want to see behavioral health patients in emergency departments, unfortunately. No one receives care other than triage in emergency department. Your worst place to be as a behavioral health patient is in the ED. So it's on both the patient and the provider, the practitioner of the hospital. The patient's going to get aggravated and agitated, possibly, because they're not on any meds. They haven't gotten a psych consult because there's no one to do the psych consult. But you don't get the best care from emergency departments. God forbid there's an unnecessary admission to an inpatient unit. I've managed units that had 4-year-olds on those units, and they're commingled with male, female, a 13-year-old, very aggressive patients. And a 4-year-old and a 13-year-old, just, it does not mix well. So we have to do everything we can to keep the patient healthy within their community. And if they end up in the ED, get them discharged as fast as possible to the best place and the best care possible at that time. And that's what we do at Revive. We're on demand 24/7, and we're partnering with facilities to make sure that we are seeing patients efficiently, effectively, in the best quality manner.
Can you provide a little background on your personal mission and maybe your purpose as an individual and how that overlaps with the work that you do with Revive?
As I mentioned before, the next shiny thing, the biotech revolution, the life sciences revolution, has been great, but just getting care to patients, we have struggled in many settings to do that. The emergency department is one of them. Emergency departments are typically required by federal law to take every patient that crosses the threshold and stabilize them at the very least, regardless of their ability to pay. When patients walk in with complex behavioral health issues, it really puts a strain on the clinicians, because when somebody comes in with a gunshot wound or a knife wound, it's pretty clear what's wrong. If someone comes in with a substance abuse issue or schizophrenia or major depression, it's a little more difficult and time consuming to figure out, and most emergency departments don't have a dedicated clinician, a psychiatrist or psychologist or social worker trained in behavioral health that can assess the patient. As Omar was saying before, it creates a tremendous bottleneck in the system, and it creates high stress for patients and for the clinicians, and it results in very difficult, costly situations. And so my interest was helping to solve that problem and getting people the care that they need efficiently and in a way that doesn't overtax the system, either in terms of personnel or costs.
Can you explain how Revive Telehealth works and what makes it different from traditional behavioral health services?
So we partner directly with hospitals to provide a B2B on-demand service. You use it as you need it, and what happens is a patient walks in the emergency department, and that patient is deemed a behavioral health patient, or the physician or the attending of record deems the patient as needing a behavioral health consultation. At that point, the hospital submits a consult to our application, and our application pings our provider, the Revive provider, who logs into our system, sees the patient, documents directly into the EMR, signs the note, moves on to the next patient. So it's very efficient. We have a 3-step quality process, but it ensures that we're seeing the patient for what they absolutely need. Mostly medication recommendations, because we do have prescribers on, NPs, PAs, and MDs. And disposition is also, can I discharge this patient? Are they making sure that they're not going to go harm themselves or others? Yeah. So safety discharges and medication recommendations are what we do the majority of.
Or recommended admissions where it's appropriate.
We do have some inpatient acute care, capacity assessments, dementia-related illnesses, altered mental status that we see, and we could also do some medication management. Those patients are typically on a lot of different medications, so it's important to get that prescriber level expertise from a behavioral health clinician in on that.
Yeah. And your staff will access via the contract the hospital where the patient is located, as opposed to your own in-house EHR.
Correct.
Yeah. What has been the biggest operational challenge in delivering 24/7 on-demand care across multiple states?
So you would think that it's recruitment, or you would think that it's privileging the providers at systems, because when you see a patient within a hospital system, our provider needs to be privileged to see the patient within that, right? We've had very little tech and very little alignment issues on that perspective. My largest barrier is getting in front of these buyers and getting them to say yes to Revive. And that's been the largest issue. If I could save a facility 30 to 50% per consult, I don't have a subscription fee, I don't have a minimum, I'm going to be able to do it because my costs are extremely low and I want to be able to provide that back to get a great quality care. You have companies that are providing the MD level, which is great. There's a shortage and it's going to continue through 2030. The data represents 2027, 2028. I think it's going to continue to go on. But there's a shortage. They're charging premiums, and it makes it very difficult, especially with payers always reducing and clawing back reimbursements. It makes it very difficult to continue to use these services. So what hospitals end up doing is they end up relying on their own attending to make the call. They rely on social work staff to also do discharges, therapeutic discharges. Our biggest issue and our biggest barrier is to get in front of those buyers, those CEOs, the CN, the emergency department folks, and so on.
And Phil, as you probably know, the buying process for most hospitals, whether it's standalone or whether it's an integrated health system or other sort of structure, the buying cycle for those institutions, those facilities, is painfully long. And part of the impediment, as Omar said, is finally getting in front of the right person to make the case about the safety and efficiency and effectiveness and return on investment of using Revive services.
How do you measure impact and success, both clinically and operationally?
Well, I would say success is based on discharging the patients appropriately and seeing them efficiently and effectively and saving costs for the facility. If we are seeing the patients in a timely manner, if we are providing a service that brings great quality care, that treats the vulnerable patient in a manner with dignity and respect, if we are providing a service that saves them some money, then I think we're doing a great job, right?
Yeah.
And that's without talking to the systems and getting feedback, 180 feedback or whatever it may be. That's sort of what we look for just from a subjective perspective.
The return on investment analyses we've done.
Oh, yeah. Yep. That's a great point, Ted. Part of that efficiency and that cost savings is that we can provide you with 100% to 1100% ROI. And the 100% is if you use us to provide a consult, Revive Telehealth to provide a consult versus a physician outside the organization or within the organization. And we base that on costs we've taken nationally as provider costs compared to our costs. And then the 1100% is the hospital wants to admit this patient. We see the patient. We say, no, the patient is safe for discharge, and we save on an avoidable admission. We could possibly see even more than 1100%, but the 1100% is based on discharging that patient that they want to admit because of defensive measures, because there's no place to discharge the patient because they don't know if they're safe or not. Thank you for bringing that up, Ted. That's a good point.
What happens to the patients after they see Revive Health in terms of some ongoing care? Are they referred locally? Is there continued care with Revive? Where does that transition take place?
So unfortunately, in this stage of Revive, there's no continuity of care. It's pretty much we see the patient, we give the EMR, electronic medical record, documentation, and recommendations. We've worked with the facilities and the social workers to say this is probably the best place for them to be seen and follow up with. Outpatient, IOP, PHP, going back to rehab, skilled nursing facility, and so on. So we do work with them, but since we are not really of the community, it makes it very difficult to figure out what is actually in the community as a service.
I think it's very important to understand that Revive provides behavioral health consultations. It's not a telemedicine service that provides or is designed to provide ongoing care in terms of medication management or talk therapy. It's like when your primary care provider might refer you to a cardiologist for a consultation. You get the cardiologist's opinion, but for continued care, you go back to your primary care provider. Revive sits in the shoes of cardiologists, but Revive is sitting in the shoes of the psychiatrist or the psychologist to give a professional clinical analysis of what's going on with the patient on a consultative basis, and then give the clinical staff there, the emergency room physician or the nurse practitioner or whomever it might be, the view of our specialized behavioral health clinician to avoid false positives and false negatives. False positives would be avoiding an unnecessary admission that's motivated only for defensive practice of medicine purposes. A false negative would be discharging someone home or to the community who really needs to be an inpatient. And that's the problem that emergency department clinicians often face when they don't have the behavioral health specialists on staff or available to come in on call. That's the role that Revive plays. It's a consultative basis. It's not a ongoing care relationship for that particular patient.
Yeah, a specialty service. Yeah. How do you identify scaling opportunities in healthcare? How do you decide which hospitals or regions to prioritize?
It's our current strategy right now. So I'm not going to give that all away, but there's a lot to do with who your current clinicians are licensed, what states they're licensed with, what compacts are out there. System-wide, can you get into the mothership and work your way down, or can you get into one of these system sister hospitals and then work your way up into a larger organization? We've done work within rural settings at smaller hospitals, one-offs, and we've done work in very large facilities and hospital systems. So it just depends.
Yeah, definitely. How do you balance technology with human-centered care?
Oh, that's great. We are mostly human-centered care. What separates us, I think, from the competition is that we are clinical first. We're a clinical model first, and then we use tech to assist us and aid us in the service delivery. That's what's important versus a lot of other services that use tech first, have a clinical back.
I like that. I have had multiple AI experts on that work in the healthcare arena, and something I keep hearing that I find reassuring is the emphasis on human relationships first and expediting administrative tasks. AI is not out to take our jobs, but to improve human relationships and to provide more time for direct patient care. I think that's what I'm hearing from you.
Yep, absolutely.
Where do you see the biggest opportunities or challenges in healthcare over the next few years, specifically with behavioral health?
I think tele is going to continue to grow. Unfortunately, what happened was this huge thing called AI. And so a lot of the funding to aid in that growth has been absorbed by AI. Everyone's trying to get into it. I don't know if it's a bubble or not. I don't really care about that too much, to tell you the truth. AI is important and has its certain places, but it's most definitely not going to take over healthcare, right? There's that human touch and that human interaction that still need to do the job. AI can assist in that. I've seen great AI tools document and take notes and summarize and do phenomenal things. But to sit there and to review a patient that's suicidal or not suicidal, that's schizophrenic or has some sort of underlying diagnosis that they're not speaking out, is pretty hard. Triaging, but not fully assessing. I could see consolidation coming with a few of these larger folks. The direct-to-consumer, the folks that, the Lemonades, the Teledocs, that nothing bad about them. They do a great service. But they hit the folks that are comfortable from the comfort of their home, right? The folks that don't need an emergency department, the folks that need depression medication, anxiety medication.
Those are counseling services?
Yeah, counseling and medication management, sort of direct-to-consumer, B2C.
Yes. It's B2C, urgent care, to the extent urgent care can be provided by telemedicine. That's where I think telemedicine and telehealth really started and got going, is the direct-to-consumer model. And that model's fine as far as it goes, but the fact of the matter is, the secret is that anybody can do it. All you need is a camera and a computer. It's not magic. And in order to provide the volume, a lot of these direct-to-consumer operations have relied on insurance companies, third-party payers, to drive their volume. And the one thing that third-party payers never do is try to grow your margins, right? So, they're looking after their own margins, of course. So I think that's put the direct-to-consumer model in a very tough place. There are a limited number of encounters that one can do via telemedicine in that sort of general medicine, generally well kind of population, being beholden to the third-party payers makes the job be very difficult. Revive is bringing a highly specialized service with board-certified behavioral health clinicians to provide consultations where they're really needed in the hospital, in the emergency department. It's not a general sort of telepsych kind of service. It's a B2B offering where Revive contracts with the hospital and provides that consultative expertise to give the emergency department staff the information they need to either write a prescription, admit the patient, discharge the patient, refer the patient to ongoing care for talk therapy or detox. That's where Revive fits in. So Revive is definitely not anything like Teladoc or any of these other direct consumer providers.
Yeah. And real quick, just from an overall national view, we don't know what the big beautiful bill really is going to do. And so I think that cutting down on costs in Medicaid, it's going to have to make budgets a little bit more stricter on their spending. If we could save a hospital money, we're going to do that. And so what I think you're going to see across the nation is more telehealth services with folks and hospitals that can't afford a psychiatrist. And since MD psychiatrists are, I don't want to say retiring out, there's more attrition with them and a shortage, you're going to see more and more folks going telehealth, especially when you need to clear more and more emergency departments because the demand is continually increasing. So that's what we see across the market in the nation. I could see this going across the country as well, across the ocean. We need to respect regulations and all that. So,
yeah. And it finally, I'm sorry, I just want to jump in again. Yeah. Think about all of healthcare services, all the specialties. What is tailor-made to be done safely, effectively, and efficiently over telehealth? Behavioral health is. You can't do surgery via a Zoom call. There's a limited number of vitals that you can take and have confidence in by telemedicine. But in terms of the kind of assessment behavioral health patients need, it's perfect. It's tailor-made. It's a fundamental realization about the best uses and the best applications of telehealth.
Perfect tool for this long-term segment of medicine. Technology provides a perfect tool for this. I love it. I'm going to bring things together on our final question. What does business growth look like for you guys in the short and long term, say the next 12 months and the next 3 years? What are your aspirations for Revive Telehealth?
I have a few proposals out and I wish to continue to grow it. There are some larger organizations that I really think we could help with the 24/7 on demand and support them in how to get a little bit more efficient. So we're going to continue to grow out in Texas and then wherever else makes it more of a strategic land point for us, right? If it's something that is worth and in a completely different state, but it's another growth state, then we'll also most certainly look into that. But right now it's Texas and seeing where else we could grow within there. Had a few phone calls and Midwest area and then also the West Coast. So let's see where it takes us. But the next 3 years is just grow. Yeah, and develop our app. It's an internal app. It's an efficiency app. It helps create more of a streamlined service for providers and their, I'm a huge proponent of you got to make sure your employees are happy and they stay in the job because retaining them is very important and turnover is very bad and costly. We want to be able to retain our employees as much as possible.
Makes perfect sense. All right. Well, I want to thank both you gentlemen for joining me today. I know you guys are busy taking care of Revive Health and launching your business and keeping it sustained. Thanks so much for sharing some insight. It's been a pleasure. Where can our audience go to learn more about Revive Telehealth?
ReviveTelehealth.com.
Perfect. We'll include those in the show notes. Thank you again for spending time with us. Really appreciate you coming on the HealthCast.
All right. Thank you so much.
Thanks, Phil.
You bet, Ted. Thanks for joining us for another episode. Stay tuned for more. Thanks for listening to the HealthCast. If you enjoyed this episode, please like, follow, and subscribe. And share it with someone in healthcare or digital health. And if you're a healthcare leader focused on scaling your business or improving operations, I'm always open to connecting. You can find me on LinkedIn. There's a link in the show notes. Thanks so much.